What is the objective, Maggie, of the physical therapy, and how can it help patients who have suffered, like Adam, from a stroke or even a spinal cord injury?
Yes, so in this setting, our goal is basically to restore function, increase their mobility, basically promote health and wellness. And we do this by just basic skills of learning how to get in and out of bed, how to get in and out of a chair, get into a wheelchair, learning how to use a wheelchair, being proficient with the propulsion, learning parts management of the wheelchair, and getting patients back to walking again. And we do this by prescribing an exercise program. In fact, in the patients that I've seen with spinal cord injuries and strokes, if they're very debilitated, have a lot of weakness, our biggest thing that we start working on is learning how to propel a wheelchair. If they have pretty good upper body strength and function, we learn basic wheelchair level skills, propelling the chair. As you can see, Chris over here is demonstrating his ability to go up and down a ramp and then doing a wheelie, which is a much more high level skill. It's not something that we're going to learn right away, but is something that we will eventually get to. Chris also demonstrates in this video the ability to jump off and on a curb. So that is not an easy skill to learn. He was a great patient for us there. A patient is also very weak in their upper body and they have difficulty with being able to propel a manual wheelchair. We also have a great variety of demo wheelchairs, power wheelchairs, and again, Chris is demonstrating for us here on this video hand control function, so he does have hand control. If a patient does not have good hand function strength, we have other options where they can control the wheelchair with their head. They can control it using their chin. Right here is the chin switch. Chris is driving the chair using his chin. And then there's another system via a straw, which is called a sip and puff wheelchair. So this way, patients can have independence. Even if they can't move their body by themselves, they are able to get around their room, be able to come and drive themselves to and from therapy, which is very important for our patients to be able to control some part of their environment here while they're in rehab. If they're are able to do some standing and walking, but yet they might not be stable and strong enough, we also offer body weight support system, which is research-based, has had a lot of research showing that it improves patients' ability to be able to stand and be able to walk at a normal pattern, which is nice because a lot of patients are unable to support themselves initially when they first are injured. And this way it allows the therapist to really focus on getting their walking to be more normal as it's supporting their body weight. So it makes it safe for the therapist and it makes it safe for the patient also.
So when